Friday, the data that Johnson & Johnson submitted to the FDA for its emergency use authorization was made public.
Dr. Frank McGeorge has spent the day digging through these numbers. First things first here, Doc, how does it compare to the vaccines from Pfizer and Moderna?
Well, you know, Kim and Devin, there are so many different angles to compare them. Let's just start with efficacy. Remember, the FDA's initial goal was a vaccine with a 50% efficacy. Overall, the Johnson & Johnson vaccine came in strong with a 66% efficacy 28 days after the single dose is given. That's really good, but it's obviously lower than the 94 to 95% efficacy that's seen 14 days after the second dose of a Pfizer or Moderna vaccine. But that's not really the whole story.
The Johnson & Johnson study looked at 40,000 participants. Half received the vaccine, the other half received placebo. The study was done in multiple countries, including the United States, South Africa, and Brazil. That's important because of the emergence of more contagious variants and the possibility they could make the vaccine less effective. In fact, the vaccine had a 72% efficacy in the United States compared to only 64% in South Africa, where the more highly contagious variant B.1.351 is dominant. Another way to look at the effectiveness of the vaccine is to ask how well it prevents severe disease. In that respect, the vaccine was very robust at 85%, especially in younger people 18 to 59 years old, where it was 92% effective. The vaccine had a lower efficacy in people with other medical problems that make COVID worse, 59% compared to 69%. Differences like these may provide guidance to recommend the vaccine preferentially to specific groups, possibly younger, healthier populations. The study did look at the question of whether the vaccine could prevent asymptomatic infection, which is important to limit silent spread. They found the vaccine appeared to be 74% effective at preventing asymptomatic infection, but they didn't feel confident in the number because of limited follow-up time and sample collection.
Now, I've just focused on efficacy, but in comparing the Johnson & Johnson vaccine to Pfizer and Moderna, you also need to consider, of course, safety and side effects, and I will have that coming up at 6. Now, incidentally, the researchers sequenced 268 COVID cases from across the United States as part of this study. As of February 12th, they actually did not find any of the UK B.1.1.7 or the South African B.1.351 variants here in the U.S. But of course, we know at least the 117s are here in the U.S. The fact that they didn't find them shows they just weren't dominant during the study time.
Yeah, during the study, right. Now, the FDA's advisory panel, Doc, is going to meet on Friday, which takes us to the questions that we've had about the other vaccines. If it's granted an emergency use authorization, how quickly can they roll it out?
Well, you know, if the EUA is granted, they are ready to go. The White House task force actually said they anticipate allocating 3 to 4 million doses next week. In fact, they have already discussed distribution plans with governors. Back to you.
All right, we'll watch what happens. All right, Doc.